Hi, everybody. This is the lecture presentation for Chapter 4 of the textbook, Understanding the Whole Child. Chapter 4 is about the physical development in infancy and toddlerhood, and we'll break down different types of development by age group. So we'll spend some time on our infants and toddlers with this chapter being physical development, and then we'll also address cognitive and social emotional development before we then move on to the preschool years and so forth. So this book is all about this chapter, sorry, is all about physical development, and I will just dive right in. So physical development during infancy and toddlerhood is one of the most fascinating and well-studied areas of development. Probably one of the most well-studied because of how fascinating everyone seems to think it is. And this stage gets so much attention because the changes truly are dramatic. Babies go from being completely dependent to walking, exploring, and interacting with their world in just a few short years. But it also raises an interesting question. Is the significance of these changes sometimes overstated? While these milestones, of course, are crucial, it's important to consider how they fit into the bigger picture of lifelong development. So here we go. We'll dive deeper into this stage and what makes it so remarkable and why it's often seen as a cornerstone for future growth. I'm sorry, I had it on the wrong slide. All of that, I meant to have it on this slide while I was saying that. And then here's my next slide. So one of the hallmarks of physical development in infancy and toddlerhood is rapid growth. At birth, the average baby weighs about 7.5 pounds and measures about 20 inches long. But by the time they're just 4 months old, they've already doubled their birth weight. And by their first birthday, their weight is tripled. And they've grown to about 26 to 28 inches tall. We'll call it tall then instead of long since they're standing. And by age 2, their weight has quadrupled. And this extraordinary growth requires a lot of energy, which is why sleep plays such a critical role during this period. Growth hormones are released during sleep, supporting all this physical transformation. So those long naps aren't just restful, they're really essential for the job a baby has to do. So at birth, the brain is 25% of its adult weight, growing to 75% by age 2. That rapid growth is driven by synaptic blooming and myelination, which help the brain process information and support early development. So that is very rapid growth. And by 2, they've got 75% of their total brain size. Newborns are born with reflexes critical for survival and development. The rooting and sucking reflexes help them feed, while the grasping reflex allows them to hold on to objects. The Moro reflex looks like a startle response, and the Babinski reflex causes their toes to fan out when their foot is stroked. The tonic neck reflex resembles a fencing position, and the stepping reflex makes it seem like they're trying to walk when their feet touch a surface. And these reflexes actually fade as babies grow, but having them is a key indicator of healthy neurological development. So we do want to see if babies are doing these things and make sure that they have these reflexes. So gross motor development in infancy and toddlerhood follows a predictable progression. Of course, gross motor development being those big major muscle groups and the big movements that they make. Early on, babies hold their head up, they push up during tummy time, and they make smoother arm and leg movements. By 3 to 6 months, they roll over, they push up to their elbows, and they may sit with support. And then by around 6 to 9 months, they're sitting unsupported and might start crawling. And then by the time they're a year old, many pull to stand, they cruise along furniture, and they take first independent steps. And they refine their skills, walking up steps. This is as toddlers, sorry. Once they're toddlers, they refine all those skills, walking up steps, running, even kicking or throwing a ball. And gross motor milestones show how children gain strength, coordination, and independence over time, because you can obviously see that each of these requires a little bit more strength and coordination than they had for the previous milestones that they had hit. And then those fine motor milestones in infancy and toddlerhood highlight growing hand-eye coordination and precision. Early on, infants grasp reflexively and hold their hands in fists. By a few months, they bring hands to their mouths, they track objects visually, and they start reaching for their toys. Then at around 6 to 9 months, skills like passing objects between hands and using that pincer grip emerge. And by 12 months, they can put objects in containers and they can poke with a finger. Toddlers, again, just like with gross motor skills, refine these skills further. They stack blocks, they scribble, they feed themselves with more accuracy. And these milestones show the gradual development of dexterity and coordination that they are gaining. Newborns see best at 8 to 16 inches with poor color vision and 2400 acuity. But by a few months, vision sharpens to 20/25, color vision develops, and depth perception emerges. Senses are well developed at birth. Infants respond to sounds from any language until 7 to 8 months and show preference for their mother's voice and smell. Okay, so now we're going to talk about nutrition in infancy and toddlerhood. Breast milk provides optimal nutrition for infants. It offers essential nutrients and antibodies that help strengthen the immune system. It's easier for infants to digest compared to formula, and breastfeeding has health benefits for both the infant and the mother, including bonding and potential long-term health advantages. And the American Academy of Pediatrics recommends breastfeeding for at least the first 6 months. However, despite these benefits, many U.S. mothers do stop breastfeeding by 6 to 8 weeks due to various challenges that might include work, their personal preferences, or breastfeeding difficulties, because even though it seems like it should be natural and easy in what we were made to do, it can be hard. It can be painful. It can be tough to produce enough milk. And of course, that gets frustrating, and you want to make sure that your baby's getting enough. So there are just all kinds of complexities that can be tied to what should be one of the easiest things in the world for us. But that's not always the case. Formula feeding is a viable alternative to breastfeeding, providing the necessary nutrients for infant growth and development. Research does show that both breastfed and bottle-fed infants can adjust equally well emotionally, as long as their overall caregiving environment is responsive and nurturing. So, like one thing I would say is, I mean, obviously with infants, you have to do this anyway, but, you know, holding a baby while they have their bottle, not as they get older, just giving them a bottle, because then you're missing out on that bonding and caregiving time that you get from breastfeeding. But a way to compensate for that is to hold baby while they eat. And so the key is ensuring that the infant's nutritional and emotional needs are consistently met, regardless of which feeding method is used. Solid foods are introduced around 6 months when they show signs of readiness, as long as they seem like they're ready by 6 months. And by 7 to 8 months, infants can try cereals, meats, fruits, veggies, and dairy. You want to always make sure you introduce one food at a time to watch for allergies. And at a time means maybe wait a couple days in between, not just bites, not one at a time bite-wise, but one at a time by several days. This chart outlines typical meal patterns for infants from 0 to 11 months. And the first 0 to 5 months, breast milk or formula is the primary nutrition. And then around 6 months, solid foods like cereals, meats, fruits, and vegetables are introduced. And by 6 to 11 months, infants typically consume 6 to 8 ounces of breast milk or formula, along with a variety of other foods. Snacks like crackers or fruits can also be introduced, but breast milk or formula remains the main source of nutrition during this time. And this chart shows typical meal patterns for toddlers ages 1 to 2 years old. So it can give you some good ideas of some foods to feed them and about how much without expecting, we don't want to put grown-up portion sizes on there. They don't need that. The most common forms of malnutrition we see in infants and toddlers are wasting and failure to thrive, particularly in certain populations. Wasting tends to be more prevalent in areas with high levels of food insecurity where children are not getting enough calories or nutrients. And it's often a sign of an acute problem, such as an illness or sudden disruption of the child's nutrition. And then failure to thrive, or FTT, is also quite common, especially in cases where there are feeding difficulties, insufficient parental knowledge, or economic challenges that make it difficult to provide adequate nutrition. FTT is often seen in children who aren't growing as expected or whose weight gain has plateaued, meaning it seems to have kind of stopped for a while. And it can be caused by a range of factors, including poor feeding practices, medical conditions, or neglect. So these other conditions that you see on here are less common in developed countries due to better access to food and healthcare, but they can still occur in certain communities or in children with severe health problems or those living in extreme poverty. All right, and now we'll move on to health in general in infancy and toddlerhood. So some common health conditions found in infancy and toddlerhood are bowel movements. Newborns have frequent loose stools, which decrease as they get older. Watch for signs of constipation or diarrhea. So that's bowel movements aren't a sign of a health problem. They're just part of their health. Colic would be a problem, and it's excessive crying for several hours a day, usually starting at 2 to 3 weeks and easing by 3 to 4 months. And then diaper rash is caused by wet diapers. It's usually mild, but it can lead to infection if it's untreated. Spitting up or vomiting is normal in infants due to small stomachs, but frequent vomiting could indicate need for concern. Teething, of course, is a common health condition of infants and toddlers. Around 6 months old is pretty typical to start. It's going to cause them discomfort. It's going to cause them to drool and often a mild fever. Urination. Healthy infants urinate 6 to 8 times a day. Fewer wet diapers could signal that they're dehydrated. And jaundice is yellow skin or eyes in newborns, and it usually is resolved on its own, but it could need treatment if it's severe. Shaken baby syndrome. The definition is that it's a form of abusive head trauma caused by violently shaking an infant or toddler. An infant's brain is fragile and it can be injured from the force of shaking. Signs to look for are irritability, lethargy, meaning like just not much energy, difficulty breathing, vomiting, seizures, or even loss of consciousness. And it can lead to permanent brain damage, developmental delays, or even death. To prevent it, people need to be educated on it. Educating caregivers about the dangers of shaking an infant is crucial. It happens when adults are frustrated, and caregivers need to take a break, place the baby in a safe spot, like their crib, while they step away and calm down. And it's important, of course, to never shake a baby, even in frustration. The consequences can be devastating, and it's important to seek help for anyone struggling with infant care or emotions. Vaccines help the immune system fight future infections by introducing weakened or killed versions of the virus they're trying to protect against. Most side effects are mild, and serious reactions are very rare. Declining vaccination rates have led to the return of vaccine-preventable diseases. Vaccinations are crucial for protecting both individuals and communities. And here's a recommended vaccine or immunization and vaccine schedule put out by the CDC. and safety in infancy and toddlerhood. It's essential to protect infants and toddlers from common injuries like suffocation by keeping small objects, soft bedding, and plastic bags away from babies. Drowning, always supervise children near water, even very, very shallow water in small amounts. Fires and burns, you need to keep hot items like stoves and heaters out of their reach. To prevent falls, use safety gates and secure furniture to prevent falls. And to prevent poisoning, store chemicals, medicines, and cleaning supplies out of children's reach. Ensuring safety in these areas helps prevent serious accidents and injuries. Of course, we should always use the right car seat for a child's age, weight, and height. Rear-facing car seats are recommended until age 2 or when your child reaches the seat's weight or height limit. Forward-facing car seats should be used after the rear-facing seat and until the child reaches the car seat's weight or height limit. And booster seats are for older children who outgrow their forward-facing seat but are still too small for a seatbelt alone. Ensure that car seats are properly installed with the harness snug and secure. Never place a rear-facing car seat in the front passenger seat with an active airbag. And always follow the manufacturer's guidelines for your car seat. Some additional points about sleep. We talked about it earlier and how important it is for their growth. Newborns sleep in shorter bursts and have shorter sleep cycles, which can be as brief as 30 minutes. And as they grow, those sleep cycles will lengthen. Their environment, it's important for infants and toddlers to have a safe, quiet sleep environment free from potential hazards like pillows, blankets, stuffed animals, and such to reduce the risk of suffocation or SIDS, which is sudden infant death syndrome. Babies often develop associations between certain actions like rocking or feeding and sleep. So over time, toddlers may learn to self-soothe, but it can take time and consistency. Infants typically sleep through the night, but may require several naps during the day. And by 6 months, some babies start sleeping for longer periods at night, but naps still remain an essential for daytime rest. And sleep training, some parents may engage in sleep training methods to help babies establish a more predictable sleep routine. It's a highly individual process that you'll find that a lot of parents have strong feelings about on one side of or the other. But good sleep hygiene, consistency, and a calming routine help infants and toddlers develop healthy sleep patterns, and that's essential for their physical and their cognitive growth. It's important to follow safe sleep practices to reduce the risk of SIDS. Babies should sleep on their back. That's for naps and overnight. They should sleep on a firm surface, a firm mattress with a fitted sheet, avoiding any soft bedding, pillows, blankets, or stuffed animals, as those can pose suffocation risks. Sleep in the same room with parents, but not in the same bed is what's recommended. It's recommended for infants to sleep in the same room as their parents, but on a separate sleep surface like a crib or a bassinet. Co-sleeping in the same bed increases the risk of suffocation and of falls. Babies can get hot in the night or while they're sleeping. Dress babies in light, breathable layers. Ensure the room temperature is comfortable for an adult and avoid overbundling babies. Do not smoke. Ensure the baby's sleep environment is smoke-free, as exposure to smoke increases the risk of SIDS. Offering a pacifier at nap time or bedtime can help reduce the risk of SIDS. Avoid using a pacifier with a string or a cord, and don't force the baby to take it. And tummy time when they're awake helps strengthen the muscles and promote healthy development, but never put them on their tummies to sleep. So these are guidelines for a safe sleep environment, not only at home, but in child care centers when you're in the infant room. So that is chapter 4. I hope you've learned something new, or certainly things that you will find valuable.